Welcome to the Low Carb MD Podcast. No one is beyond help. No one is beyond hope. Nothing said on the Low Carb MD Podcast is medical advice. Please consult your own doctor before making any lifestyle changes.
Hello and welcome back to the Low Carb MD Podcast. Tro, man, we have a legend that we're interviewing today that we get to hang out with.
Oh, I'm so excited. I've seen Dr. Dan on social media, on YouTube, on Twitter, on Instagram, and I'm watching him and I'm just like immediately I'm enamored. I'm like this guy's saying everything that I feel, saying everything that I think, and on top of it, it's with a British accent. So he sounds 10 times smarter saying it.
He can get away with it. He's got the Unwin effect going on, man. They can get away with stuff we can't because we're not cool, right? But, you know, I was seeing him say stuff that was like no one else was saying at the time that was true, but no one would say it because they were afraid. And then I'm like, oh my gosh, he's posting. I would think it. I'm seeing it posted. I'm like, oh my gosh, it's like I was just telepathing it. But also, when he starts talking about metabolic health, I was like, oh my gosh, he's on board with metabolic health too. And so we're kind of very much aligned and, questioning the paradigm, I think, is really, really important. So let's shut up, Joe, and let the man speak. Suneel, welcome, man. It's great to have you, Doc.
Thank you very much for that very kind introduction. And I've been waiting to meet up and talk with you all for a while as well. So I think we're going to have a lot of fun here.
Dangerous talk with all three of us together, man. Tro.
It's definitely dangerous.
It's fun.
It's fun. I got to be honest. Absolutely inspiring to see somebody get out there, talk fearlessly. And I think the more of us that come out and do what we're doing, and the more we band together, the more power we all have and the more influence we all have. And we're all in this to help people reclaim their health. So I think, I'm just so honored that you came on. It's a Saturday morning. You could be with your family. And I'm excited to hear what you have to say.
Yeah, exactly. And as you said, it's all about those voices speaking up because we're all here for a good reason. We can see the complete and utter insanity of our current situation. We know how doctors are kept in line. In fact, my video next week is all about why doctors are so fearful, and we can delve into that later. But I'm really hoping, as I know you are too, that this is a snowball effect, that more start speaking up, and we know how the world works. It starts with a few whispers. Then it's a whole room speaking, then it's a whole town speaking. And then before you know it, you have an unstoppable movement. And that is our goal here, isn't it?
Yeah, and I think that's the thing is the problem was, like, I realized this right away. I take care of some Navy SEALs. The Navy SEALs, if someone takes the hill, everyone lays down fire for them, stands up, draws attention, right? So that the other person can. In medicine, everyone hid and whispered, you go, Suneel, go take the hill. You go, man. I can't say anything because I work for a big corporation, or my bonus may get affected. And that was a sad part about medicine, is very, very few. And the problem was when you're one of the few, you're a target. That's why, as we speak, I'm sitting in Arizona. California was way too dangerous to speak the truth. It's the truth, but it's you're going to lose your medical license. It was a struggle for me because I go, look, I worked hard to get my medical license. I think I take pretty good care of patients. And man, what they can do to you is it's scary. It really is.
It is indeed. And most doctors out there are living in this state of fear. And it's very sad because if there is one profession out there which calls for people to be brave and step forward, it's what we do. It's medicine. And I think this is a historical problem going back a long time. I mean, I always hate that Nazi Germany comparison, that classic example, but you look at what happened in the 1930s when they took power, the very first group to fall in line with them were the physicians, if you look historically. So this is a deep-rooted systemic problem within our profession, and our profession should actually be the least likely to behave in this way.
Yeah, and when the plague hit, right, the doctors were the first ones to run for the hills. They were hiding and they wouldn't see patients. And like we saw the same thing, at least in San Diego, a lot of doctors wouldn't even see patients anymore. They went to telephone only, not even Zoom, telephone only. I'm like, and they would say, go to the ER, go to the ER, right? Wait till you turn blue and go to the ER. And you go, oh, holy cow, what kind of you're supposed to be protecting these people. Sorry, Tro, go ahead, man. I just get excited.
No, no, no. I think you guys hit the nail on the head. And the way I love the way, Dr. Dan basically said it was there's a systemic problem in medicine. And I'd love to elaborate that all. I'd love to hear you talk about it because it's very difficult when we're trying to explain it to our family, our friends, our loved ones. Sometimes it seems so far-fetched that it could sound like a bit of a conspiracy, except we all know it's not. And so I think the more we elaborate on exactly that systemic problem, the more real it becomes and the more palpable. What Brian said, it's like we see this all too often, with that doctor that cowered away, and locked his kids in his basement when, COVID was happening. Like that was systemic. People who, wore 5 masks and shamed other people for not wearing 5 masks, who took experimental vaccines, this was commonplace. And I'm just curious, if you could help, I love that word, there's a systemic problem in medicine, and you dated it back, to the Nazis. And if you look at the Tuskegee, it was there. And if you look even in modern day, it's still there. So I'd love to hear you elaborate on this systemic problem in medicine.
I can think of three right off the bat. The first is that doctors graduate with absolutely insane amounts of debt. The importance of that should not be overlooked. And it goes up every single year. Doctors, for a long time, they train for a long time, have worked for many years to get to where they are. And now doctors, hundreds of thousands of dollars in debt. I've seen some almost $1 million in debt. And when you take a young graduate in that circumstance who has the whole mentality, have worked so hard, I've got to pay all this money back, they are not going to want to rock the boat and risk their entire future. They have dreams, they want to get a mortgage, they want to start a family. And it's what I call a perfect storm for these bad actors to come in. So the way that healthcare works, the strings that are pulled at the top with big business, big pharma, perfect storm to have doctors in a state of basically servitude. That's what it is. Servitude. You've worked hard. Here you are. You are going to follow the path. You're not going to rock the boat. Otherwise, your career, your whole financial future is in jeopardy. So that's the first thing. And we can unpack these one by one. The second big point I want to touch upon is that doctors are simply not taught critical thinking skills. The whole mentality from the very beginning is let's memorize absolutely everything. We will take orders from above, whether we're a medical student, whether we're an intern, whether we're a resident. We do whatever our attending says. And then when you are an attending, you do whatever your physician society and professional agency tells you to do. So that is hammered into people, brainwashed, indoctrinated to do what they're told. And the idea that you would take a step back and you would think, hold on a minute, I'm going to critically appraise data myself. I'm going to think for myself. I'm going to break everything down and I'm going to ask questions. That is a foreign concept, sadly, to most people in our profession. The final point is the physician societies, the professional agencies. And my goodness, if there were bad actors in healthcare, we should pin the blame on them. They are riddled with conflicts of interest. I refuse to join any professional societies. It's been a long time since I've done that. You go to any conference in the United States, or indeed most Western countries, and you will see thousands of doctors walking around, going to their conferences, diligently taking notes. And then the biggest part of the conference is the exhibitor hall in the middle. We've all been there. We've all seen this. You have these big business players, big pharma that have paid the agency thousands, maybe even millions of dollars over the years to be there, and they are selling their products. So who are the professional societies going to be loyal to? Are they going to be loyal to the doctors who pay them a few $100s a year, or the big business interests that are paying them vast sums of money? So I would say that any discussion on how medicine is completely captured and doctors are compliant and fearful should focus on those three factors first and foremost.
I wanna unpack that, Brian. I know Brian's like waiting at the chomp to chomp into that, but You mentioned a couple of things. You mentioned the strengths in the first of the three. You mentioned that pharma and sort of the medical societies are pulling the strings. And I think I'd love to take that out of the abstract and bring it into what actually happens. You and I have been in hospital systems. Brian has been in we've all been in residency. We've all been employed. We've all been, sort of preaching outside of that same system. So if you could help paint that influence, that sort of invisible hand. And the second thing I'd love if you can do, you talked about the medical societies and these conferences that have conflicts, and what you've seen out there that maybe inspires you. I mean, the AMA is so discouraging. The state medical societies are so discouraging. The AFP is taking money from Coca-Cola. I mean, but what, in your opinion, are there any bright spots that you think? So I'd love for you to elaborate on this.
Sure. Yeah, I mean, the first question about how this works. So if anybody out there is listening, say you're a patient, you will get a series of recommendations from your doctor about what to prescribe. There'll be certain cutoffs for, say, blood pressure or cholesterol. And what a doctor does is very much determined by protocol. The problem is that the people who are making those protocols and putting forward the recommendations from the top are themselves loaded up with conflicts of interest. So you have members high up of physician societies that know that a large chunk of their income is coming from these other sources, whether it's big pharma or another business interest. And then they work to make sure that the doctor at the front lines, and there's thousands, hundreds of thousands of these doctors, are implementing these protocols, which result in prescriptions or certain other tests being done. When if you trace the chain back higher up, you can see that there was some sort of money exchange or very obvious conflict of interest. I'll give you an example. It could be an advisor at the top on board, at the top of a physician society or a regulatory agency that is pushing for something. And you look at the people who are making those recommendations strongly, you can quite clearly there see a conflict of interest. And then there's several links in the chain down to where the doctor is doing it. And the doctor, who is very busy, I still don't think that's any excuse, doesn't realize that the result of a lot of what they push for, whether it's saying, oh, we want the systolic blood pressure to be less than 120 or the LDL cholesterol less than 70, they think that that's all based on good science and studies, when actually it is based on a few conflicts of interest at the top that have resulted in those recommendations. Am I saying it's every single recommendation? No, I'm not. Not every recommendation out there is bad, but a large proportion are, especially when it comes to chronic diseases. Your second question about a few bright spots. Sadly, I'm pessimistic now because I think doctors are so kept in line that the only bright spots would be doctors like us, and the fact that we live in the social media age where word can get out much faster than it could before. And I think our authorities are absolutely terrified of that right now, which is why you're seeing a lot of censorship.
Yes, it's amazing. Just having a certain guest on, like on my other podcast, I had Dr. McCullough on. It got taken off of YouTube within 17 seconds. Like, how could you possibly have listened to it? And nothing was, even now to today, nothing was factually incorrect on that. No, I'll stand by every single one that's gotten taken down. And I think we've gotten to this point where you can't even discuss it and to question it. Like, we all got the letter, or at least I did. I don't know who your governing bodies are. When I was a member of the American Board of Internal Medicine, got a letter saying, if you question it, we'll take it's unprofessional behavior. This is something we've never seen before, and you're going to kill people if you don't put them on. Basically, it's 100% safe, basically, was their message. And you can't question it. It's like, well, once if I'm seeing patients coming in with damage, can I not discuss that? Right? Can I not? Is my job not to discuss the risk and benefit? Go, look, here's the risk, here's the benefit. And all these doctors who were held in high esteem said, yeah, it's 100% safe without ever giving informed consent. and saying, yeah, long-term, it's going to be fine safety without any long-term data. I'm not a good enough doctor to give you long-term data on something that we have no long-term data on.
Yeah,
You know,
this was a classic example. I mean, I asked these questions right from the beginning. I remember writing a blog in December 2020 where I actually went over the study and said the absolute risk reduction is tiny here, and it's not going to stop anything. You can't stop an easily transmissible virus. That seemed to me to be common sense, but yet I was the outcast. And I've talked about this in some previous videos. I was shocked with the ignorance of the doctors that I was interacting with, because I would ask doctors at the time who were all gung-ho because they heard in the mainstream media that this was safe and 95% effective. I said, have you actually read the study? The overwhelming majority hadn't even bothered to do that. And then I kept on doing this sort of informal polling every 3 months or so. And even a year later, most hadn't even read the studies. And it really was an eye-opener that if doctors can't even do this during the biggest news story, medical news story of their life, then what hope is there for everybody? I mean, these were very basic questions. Everybody jumped on board. It was very obvious that it wasn't going to work as intended. It was very obvious those of us at the front lines were seeing side effects, adverse events, and that was suppressed. And to me, this was a basic violation of the Hippocratic Oath and doing your job as a doctor. But yet our authorities were all in on this level of censorship and wanting to go with only one narrative. That letter you told me about, I mean, that as well, I got that email, and I remember a lot of my colleagues were very fearful. A lot of them contacted me and said, oh, be careful, look at this letter. And I just realized at that point that our governing bodies are really complete scoundrels. I could use a more strong term there, because I have been following their emails for years and years. I have never seen them all in on anything. Never once have they sent out a communication. Let's try to reduce healthcare costs. Let's try to make healthcare more accessible. Let's try to improve quality. Let's solve the obesity pandemic. Never. Not one word. But do you know what these people are all in on? Clamping down on misinformation. If you dare step out of line, if you say what you're seeing, then there will be serious consequence. And that made me realize that we have very nefarious forces that rule over doctors. And it actually inspired me rather than encourage me to shut up. I mean, I've been very open with my story. I was getting ready to leave the country. I would have found something else to do. I would have found another career. Fine. I was willing to do that because this was such an important issue to me, not only of my own bodily autonomy, but also what it means to be a doctor. And I realized that our governing bodies were far from staying true to the Hippocratic Oath. They were the complete opposite. What a shame.
Yeah, none of those guys stepped down either when they were wrong. They've been proven definitely wrong, right? There's 95% or 100% effective, safe, right? Like they made these like there's no consequence. If we were wrong, we lose our medical license and we lose our board certification. Even if we're right, we can lose our board certification. Pierre Corey, who like stood up to all this stuff, Dr. Merrick, who's the most published guy in intensive care, they both lose their ABIM certification because they spoke out. They were right. Like a lot of what they said to do got adopted, and then they still get nailed, right? And you go, man, this is crazy. And it's sad, Suneel, you raised the same thing, because I had to sit down with my wife and I said, look, I might have to find something else to do. You know, I really like, there's a good chance that these, I mean, it was such an insane time. And if you question the, 6 foot apart, I'm like, where the hell did that come from? Do we have data? There's no data on any of this stuff they're recommending, shutting down outside dining, everything that happened. And those of us in practice, like you and me and Tro, we saw, we're going to have a huge epidemic of drug abuse, spousal abuse, depression, anxiety, stress, drug, alcohol abuse, all these things. And guess what we're seeing now? we knew there was a risk and a benefit of all these things.
All of those things came true.
Can I bring it back? I'm surprised. So I got all of the same calls, and I'm so happy this is like a roundtable discussion, because getting three critically thinking, open-minded docs together, man, it's just I'm inspired. But I think the writing was on the wall, and you talked about Nazi Germany. I mean, the writing was on the wall back then, And if you go forward in time, you look at the Tuskegee experiments, which had no repercussions. Nobody was put into jail, done by the CDC. And if you don't know what that is, the CDC basically gave minorities syphilis and watched them die, right? And the only way this can happen is if there's a serious moral problem. And if you fast forward, when I was just a mere intern in the Yale system, was the time where they eliminated the medical exemption for the influenza vaccine. And the influenza vaccine, the flu vaccine, if you think about it, it's the same idea you just brought up. It doesn't make sense. It's a highly contagious respiratory virus. There's no chance of herd immunity. It doesn't make sense to mandate it. It may make sense to recommend it in high risk groups, but it doesn't make sense to mandate it. And what we saw, and furthermore, every year the strain has changed. How do you do a double-blind, placebo-controlled, long-term study in a drug that's updated and, literally a bunch of scientists throwing a dart at the board, looking at the different birds that are flying around dying of flu and guessing what strain is circulating? The whole idea didn't make sense to me. The varying efficacy from 10% to 60%. And what they did, what you saw with CMS was they went 1 year from saying your hospital must report how many patients have the flu vaccine. Then the following year in 2009, they said, we will pay you less if you do not give the flu vaccine to your patients. Then the following year, they said, your healthcare workers must report who is vaccinated and who is not, and you must have 90% or higher healthcare flu employee healthcare worker vaccination rates. And then the following year, CMS said, we will penalize hospitals with a penalty. So we saw this all go down 10 years ago, right? With an idea that didn't work. And I'm not bashing the flu shot. If you look at 2021, a double-blind placebo-controlled trial for the flu shot showed that it decreased mortality in people with coronary artery disease post-cabbage, right? An amazing study. I'm not saying the flu shot is necessarily a bad idea. What I'm saying is our governing bodies, the CMS, the ABIM, the CDC, the hospital administrators, they have no idea what they're doing. And they're more about profits and hegemony over sound critical thinking. So I wanted to hear what you think about all this. And you brought up that historical record. And were you surprised at all by any of this?
Well, firstly, I mean, magnificent points, Dr. Tro. I mean, you hit on a lot of things there. And you mean surprised in general by the COVID response?
Correct.
Oh,
Yes.
absolutely. Absolutely. I mean, I'm sure I speak for many millions of people. I mean, we thought we live in very advanced times. We've all grown up hearing the stories of the catastrophe that was the 20th century, World War I, World War II, Vietnam, and we thought, oh, now it's peaceful. Now people are sensible. Now we have technology. And I think from the very beginning, a lot of us who are more critical thinking thought, hold on, things are not making sense. This is a total emotional response. We're not following logic. And then we're watching every single country kind of go insane in their own individual way. And a lot of us in May, June, were sort of thinking, well, what's happened? Everything's shut down. I can't travel anywhere. I couldn't go back to the UK, no flights. And how long is this going to last for? Because this is a virus that has already spread. The cat is out of the bag. What are we trying to do? And then when the jab came out, I had very obvious questions. I realized from the beginning, as I said, that this was not going to work as intended. And then we saw that whole narrative taking hold. And it would be one thing if the narrative was taking hold from random people with no medical training, but it was actually coming from our authorities that this was the only way to solve the problem. Every single person 6 months and up had to be jabbed in the United States. There was no way out. We would have mandates, and it just got crazier and crazier. And I think the peak was probably the end of 2021, beginning of 2022, things panned out exactly how many of us expected. You were going to get waves and waves of COVID, and the vaccine wasn't going to stop it by any stretch of the imagination. And then as the years have rolled on, we've all had time to get back to our normal lives, realize the devastation. But in a way, I mean, I've had a lot of time to think about this, and I take a more philosophical approach. You probably know from my posts, I'm a huge fan of Stoicism, and human beings since the beginning of time haven't been known for being sensible, logical creatures, especially during times of panic. And the most you can do is try to stay firm to your beliefs, to your principles. But can I say that if something surprising happened in the next couple of years, we would respond in a more sensible way? I don't know, because I don't think humans are naturally wired that way. What I will say I'm grateful for is at least we're not in a communist country, at least not yet. Hope not. We never will be. But for standing up, we didn't get a knock on the door and get sent into our garden and a rifle to our head, because that would happen in lots of parts of the world. It would have happened in lots of times in history, like Nazi Germany or Stalinist Russia. That's what happens. I mean, at least we have to be grateful that we live in the USA and we have a constitution and we do have some basic protections. And it's very difficult to completely shut away people who are speaking up as much as they try. So that's one thing to be grateful for. I'm grateful, as I said, for social media, that we can all speak and people like us can meet up. I mean, what avenue would there have been 20 years ago for us to be on a podcast like this? Wouldn't have been there.
Yeah, I mean, I just posted about this. I was sitting down with 7 doctors and we were talking just about what we've seen. And I 100% guarantee you, if you put this online, you're all done. Like, I mean, they were telling the truth of what they were actually seeing in clinic, and you go, you just can't. Some of these things you just can't really talk about. And you had brought up the Nazi Germany, and I was thinking the same thing, thinking, oh my gosh, now we have 2 classes of citizens. They were saying, look, if you're not vaccinated, you got to be locked in your house. You can't go out. You can't go to the movies. We'll make it miserable for you until you comply, right? And when we look back at history, you can't mandate something that you don't have clinical knowledge. Like at that time, like you were saying, no one had I couldn't see the studies. I'm like, let me see the studies on this thing and see how you couldn't find the data. No one, remember they wanted to bury the data for 75 years until we're all dead. And you go, well, that's not very, if I have some really good stuff, I want you to know right now, here's my data. Tro's publishing things every week. Here you go. Here's my data. Look at it. And these guys are like, no, you can't look at it. We're going to tell you what it is. Right.
Well, they
So I
made
think
up
there was
phantom data, right? You don't remember they made up phantom
the Surgisphere thing. Like, there's no consequence for that. It was a total bogus study. I never saw any consequence for anyone, even the people who published it. The PCR data, all this stuff that we base this whole thing, you go, there's no data on this, right? Let me look at this data. And I had nightmares looking at I remember it was close to my birthday and I read this thing about how the PCR testing got approved. You're like, you've got to be, they said in the manuscript, it was published the next morning and the press releases, everything was done already. You go, how? That's impossible. It doesn't happen like that ever in medicine. So I think we all saw weird stuff and you go, okay, how come no one's talking about natural immunity? If you've already had it, like if you already had the flu this year, none of us would say, yeah, get the flu shot after you had the flu. Like none of it made sense, right? From anyone who has any basic knowledge of medicine, you go, this doesn't make sense at all.
Well, and that was a conspiracy, Brian. You know, the natural immunity, like literally, quote unquote, in a major publication is a right-wing conspiracy. You know, that's the level of propaganda we face.
That was like a new thing that just came out. We've known that for the history of medicine, right? We've known that for sure. Suneel, sorry, go on, man.
No, I completely agree. And the amount of people that should have known better. I mean, I remember one place that I was let go of for not taking the jab. And the CEO of that place, who's also a doctor, was talking to me about why I must be jabbed ASAP. And he was pushing, I don't know if you remember that complete BS study that the CDC was pushing. They had extracted data from Kentucky. They had ignored everything else, but something had shown maybe a slight benefit from getting jabbed. And he was pushing that, saying, look, the CDC showed us this study. And I was thinking to myself, you're a highly intelligent guy. How are you on board with this? How can you not see that it's not necessary, especially for someone with higher antibody levels than probably you have? And you're telling somebody to get jabbed ASAP, who's had the infection, has natural immunity. It makes no sense whatsoever. And going back to Dr. Tro's original question, I mean, it's always the few that help you through. You probably had this experience as well. You were seeing something crazy, and it was the few people that would help you and say, look, this is how you're going to get it done. It'll be fine. We'll help you navigate this. But the majority of people are always on board. And coming back again to the Nazi Germany analogy, Jordan Peterson said this, and I really love it. He said that everybody looks at what happened to Anne Frank and thinks, I would be the one hiding Anne Frank in my house. And it's complete nonsense. No, you wouldn't. The vast majority would be calling her out and calling the police. It is the absolute minority that are brave enough and risk their own lives to help somebody like Anne Frank.
So true. And, I was seeing the same thing. I'm like, these guys all would have hidden in their basement and not said a word, not said a word. And that's exactly what you did, because you have to save your own butt. And I get it. I understand it. Like what you were saying about the financial, you have 500,000. Like when I came out of med school, I think with interest and all that stuff, I think it was like 400,000 by the time I was done paying it, with gray hairs and old age. Right. But I didn't have that holding over my head still. Right. But these young guys, I get it. These young doctors, and you're trained. And I think the other thing is, we went into medicine to help people. We went into medicine because we're, we don't question the status quo. You tell us, here's what we do. And so it's just out our nature to stand up and like in medicine, you don't want to be an outlier. When you're an outlier, you get picked off. You want to be in the middle of the pack. And that's it. Like there's no lone wolves in medicine. They have to be the ones who are under great scrutiny, right? If you go, yeah, this doesn't make sense. I mean, the history of medicine, the people who were the front runners were the ones who got picked off, right? Like
Yep.
Semmelweis, right? He's talking about, hey, I think when I see this happens. And Tro and I experienced that when we were talking, when we first started doing low carbs, like 7 years ago now, and talking about it. We're talking about our patients, their mood's getting better. We're seeing it. They're happier. They're laughing. They're quitting alcohol. They're quitting pornography. And Tro's like, why is this happening? And we had doctors attacking us. We've all blocked each other, so we don't deal with each other. But they were attacking us, saying our medical license should be taken for even discussing this. Now I just got back from the low carb conference, and a whole entire day was dedicated to low carb and keto diets for schizophrenia, depression, anxiety, you name it, all that stuff. And all these people are telling their story about how their life is so much better now. But these doctors would not hear that. They could not hear that food had anything to do with or lifestyle has anything to do with health. It's how many pills you throw at them.
Exactly. And I've seen stories of all of your amazing work yourself, Dr. Tro, posted online, and it really highlights, which obviously is a big area of my interest as well. Food is everything, and doctors are really, really not trained that way, and many do find it very threatening and don't like it. I don't know where that comes from. Is it insecurity? Is it the fact that they don't know? Is it the fact that they just don't like people getting better without pills? Who knows what their motivations are? But sadly, there are many among us.
Yeah, I'd love to hear why you think it's so hard for doctors to think a little bit differently, to think, wait a second, sleep and food are the most important things for mental health. Why is that concept so hard? Is it the lack of interventional data? Is it the fact that we're sort of stuck in this idea of the faith in medicine, the faith in science? What do you think? Why is it so hard? I mean, for me, I look at the system right now and I see it makes so much sense. It's so easy. Your brain is an organ. It's hurting.
Yep.
It needs sleep. It needs rest. It needs food. It needs good nutrition. It needs decreased inflammation. It needs movement. Right? We know movement literally builds new blood vessels in the brain. Miles of blood vessels in the brain will be made. So in my mind, at least on a theoretic level, it's so easy to see. So why do you think our colleagues who are stuck in sort of the medical matrix, why do you think they struggle? Like, can we empathize with them and visualize what their problem is? What do you think their problem is?
Yeah, it's so very sad. And I know the where you're coming from as well. Anyone who's listening who doesn't know Dr. Tro's story and his before and after pictures, please look, because they are truly inspiring. And you're speaking as a person who's been on this journey and knows that basically the fundamental premise of our health and well-being is based on our lifestyle. The core part of that being what we eat. I mean, every cell in our body, every thought that we have is powered by what we eat. This should be basic common sense. Hippocrates knew it 2,500 years ago. I think doctors knew it 100 years ago. If you went to the doctor 100 years ago and you were diagnosed with type 2 diabetes because you were overweight, the doctor would give you a stern talking to because you were the absolute minority. There were not many of you, and tell you what you must do immediately: stop the carbs and sugars, or cut back drastically at least, and you'll get better within a few weeks. And a lot of patients did that. And if it was up to me, I would have taped to every medical doctor's door: we can give you prescriptions, fine, but know that if you sort out your diet and start moving more, you will have 100x benefit to any pill we give you. Keep on hammering that home. People do listen to doctors. This notion, and it comes again from a nefarious place at the top, people who want to push their chemical products onto people. This notion that Americans are lazy, they're not going to listen to doctors. What a whole load of nonsense, or complete tosh, as we call it in England. If doctors can make the entire world shut down over a virus, which most people statistically had no symptoms from, you think people wouldn't listen to doctors who looked people in the eye and said, you need to do this? Of course people would listen. Not everyone would, but a lot of people would get the message. And I think doctors don't do this because, A, they're not taught how important this is. I think a lot of doctors are lost themselves. I mean, you go to, I went to a board review type conference in Orlando about 18 months ago, and I was looking around me, and I hate to say probably 60 to 70% of doctors there were obese themselves. Didn't look very well to me. And if you have doctors like that who don't even do it for themselves, then obviously they're not going to promote it to other people. So that's a big factor as well. Doctors aren't known for taking good care of themselves. I'd say the majority are completely out of shape, never go to a gym themselves. So those would be the reasons why added to the whole mantra of the way we practice. I thought about this the other day. I'd like to get your take on this, both of you. Our subject, what is it called that we study?
Medicine.
Exactly.
Medicine.
There you go. It
Yeah.
should be called health, right?
It should be called health. Yeah.
It's for medicine in the first place.
Well, and you think about it,
Yeah,
Suneel. I mean,
think
and
about
I
it.
thought about this, and it bothered me so much because I saw the decline in the seniors for sure, right? So if I want to kill someone, if I go, look, I want you to be as sick as possible, I'm gonna lock you up in your house. I'm gonna isolate you from any social interactions. I'm not gonna let you see the sun to get some vitamin D, and I'm gonna have you eat crappy foods because people were so stressed they started eating, their and I think they say it's safer than steak now, the Lucky Charms, right? Like that's what our governing bodies are telling us now. Then you say no exercise, we're closing all the gyms, we're going to close the hiking trails where you're out by yourself in the middle of
The
nowhere,
churches.
right?
Don't
You're
forget
going
the
to
churches.
get rid of your religious interactions, right? Laughter, smiles, and I'm going to put you in constant fear, right? Nothing. We all know stress, fear, all these things will kill you fast. And so many people decline very quickly. Plus, we're going to give you so much fear. You don't want to go get colonoscopies. You don't want to go to the doctor for any reason, right? And I'm going to make you wear a mask all the time, right? That's what I'm going to do to you. If I want to hurt you, that's what I'm going to do. The only country that I ever saw during this whole thing, and it blew me away, was El Salvador, was saying exercise, drink water, eat healthy. And if you're, and I think this is what we're all going to come to an agreement. And when you talk about where's the hope is when Dr. Dhand here says, look, Callie means, Casey means, Robert Kennedy, they're all saying, hey, look, let's change what we're doing. And when you say the wheels are turning, when you say that this whole paradigm shift is happening, I think it's happening. I think the cat's out of the bag, right? Once the cat's out of the bag and people realize, now we have some retrospect. I agree. I think if there's another big thing that comes out, everyone's going to freak out. Most people are going to freak out the same way. They're going to say, oh my gosh, like you think these three doctors know better than the CDC, the FDA, and all this stuff? Yeah, we do. We have life experience. We do. We really do, because these are huge organizations and there's no consequence to them. Us, we get consequences if we're wrong, right? So yeah, I think it's a big issue. But I think when you say, well, we have common sense and clinical experience, I don't think anything trumps that, right? Especially in a pandemic, we have to see, like, historically, when you have a big thing, it's what you're seeing. They were like, what are the doctors seeing? How many times did Fauci come out and say, what are you guys seeing on the front lines, right? And as just being behind the scenes, I sat down with Peter McCullough with a few doctors, Brian Tyson, who's treated probably more COVID patients than anyone in the country. And we had a discussion. I said, so why are you doing this? Right. And what is this? Why is this? Why are we having this reaction? And his only answer was, it wasn't power, it wasn't money, it was good versus evil. That was his take. But when he came to me, I didn't want to meet with him because I'm like, is this some kind of fundraiser? What is this? He's a big figurehead. But when we sat down and talked, he said, Brian, what's working for you and what's not working? What are you noticing? Who's dying and who's not dying? And this is during the throes of this thing. And so he cared enough to say, what are you not saying? Here's what you have to do. I have this protocol. This is what you're going to do. It wasn't that attitude. But what was Fauci saying? Tro, what are you seeing in New York? Brian, what are you seeing in California? Right? There was no outreach to any doctors that I see. And anyone who said what they were seeing got banned from social media. It was just incredible.
It was.
So have we learned? Do you think we've learned something?
Well, I hope so. I think if anything, as we've already said, the good thing to come out of it is voices like ours. And I think, as you said, the cat is out of the box with regards to the metabolic health catastrophe, which the three of us are so focused on. I really do sense a change. And if nothing else, it's because, bloody hell, it's going to bring the whole country down. I'm a naturalized immigrant. I want the USA to succeed. And I live in a low obesity state, supposedly in the Northeast. And all you have to do is go to a Walmart, a Target, or a shopping mall and look at the catastrophe isn't even a strong enough word. And it's all got worse since the pandemic as well. That's the other thing the pandemic did. People stuck at home, not exercising, eating processed foods, addicted to their screens. And what we're seeing now, the statistics are off the charts. I mean, over 50% of all adults in the country obese, not overweight, but obese. You're approaching 50% of adolescents being either overweight or obese. Fatty liver disease soaring in kids, a disease that was only ever seen in alcoholics before. Type 2 diabetes in kids. I mean, the statistics speak for themselves, and they can't keep heading in this direction. Things might get a bit worse before they get better, but you can only carry on like this for so long before the dam breaks, and it is going to break. The answer is not more medicines, not more Ozempic, which is a ridiculous solution. You need to get back to basics. And I made this point yesterday when I superimposed a screenshot. You may have seen this on Twitter. So it was RFK's speech, which I consider the most important speech by any US politician in decades, when he talked about the metabolic health crisis. And right underneath on my timeline was a message from Mandy Cohen, the CDC director, telling everybody, including babies, to get the booster ASAP. And there you go. That is exactly how the establishment works against the average American, especially those who rely on the mainstream media. And at the end of the day, it's the millions of people who are relying on this information who end up getting sick, who are not understanding that they're being systemically poisoned every single day by our toxic food environment, by lots of other facets of our mainstream culture. And I made this point as well, that, you see, I consider the US mainstream media one of the most sinister forces in the world, and I'm not exaggerating. I've thought this for a long time, but what they did yesterday confirms this for me, because after RFK made his superb speech, I thought I would go online after a couple of hours and see what the mainstream media was saying. And I must have gone through 20 publications. Not one of them talked about what he talked about with health. They were all talking about how he was a conspiracy theorist, how he had gone over to Trump, how his family was ashamed of him. Not one focus on the main point of his piece and how he wants to get involved in the health and well-being of Americans. And there's another point here that people should consider. We like to pride ourselves in America on being all about democracy and good values, but actually, if you think about it, even countries like China, Russia, even North Korea, who are anti-democratic, authoritarian, they're not good countries, even their leadership and media has a strong interest in keeping their citizens healthy and strong. They do not want weak citizens. It might be for bad reasons, but they certainly don't want unhealthy people. But the US leadership and media is very happy to throw millions of our fellow citizens under the bus if it means making a buck through big business or big pharma. And I would ask anyone listening to reflect on that. That is truly one of the worst things. I think there's a special place in hell reserved for anyone who watches millions of their fellow citizens get poisoned, be on a lifetime of excessive medications, and think that that's okay, and deliberately, don't forget this, deliberately disempower them and tell them that this is normal. It's normal to get obese. It's normal to get a dad bod, normal to be on medications, normal to feel terrible and have bad mental health. That's what they are doing. And I really hope that doctors like us are the start of big things changing.
Yeah, and I think, people like Callie Means, right, going on Tucker, and that's a great interview. And he was saying, look, who's funding the news, right? You got pharma on one side, 75% of it, and you got big food on the other, 80% of the remaining 25%, something like that. And you go, oh my gosh, we got a problem. And like you were saying, I hate to look at mainstream media. And I was actually kind of, when I heard the interview with gosh dang it, Trump and Elon Musk, and Trump had a lisp, right? Because he was wearing a bad microphone. All these people said, all these doctors, he had a stroke. He's not fit to serve. And you go, oh my gosh, it was there was another recording. It was a perfect, right? He spoke fine last night. And so it's an amazing, like you said, there's no substance of what they said or what matters. It's just finding that flaw somewhere. And you see, it's like, and everyone says, the thing for me with mainstream media that makes me crazy is they all use the same words. And it's not even like creativity. Yeah. Like, this is a threat to democracy, or this is and you go, how can everyone, and that's what struck me with the whole COVID response. Everywhere around the world acted the same way, except Sweden, maybe, right? But after everyone at the beginning acted the same way. And then other people said, well, maybe we try it a different way here and see what happens. Everyone said, they're going to kill half their population, and it didn't happen. And you go, okay, like, who was right and wrong? I mean, all these things of, like, in retrospect, we can have a lot better understanding, but hopefully what I'm getting at is hopefully we can learn some lessons from these things. And when you see everyone saying the same thing at the same time, you go, that's weird. Why is everyone saying the same thing? When these new weight loss drugs, all these social media influencers are all in. No one said, hey, we better wait and see, make sure. And if you were the one saying, we better make sure this is safe, now we've learned a lot over the last couple of years, right? We didn't have long-term data on that either. Everyone said long-term safety is great. All these governing bodies recommended. You're like, based on what? How can you possibly make that recommendation with no data? Doesn't make any sense.
Exactly. And we see the same thing. History doesn't repeat itself, but it does rhyme. I mean, look at what was going on with opiates 25 years ago, where you were a bad person if you didn't give oxycodone. It's all very repetitive. The same people get rich, then it will end up in trial. I mean, with the weight loss drugs, semaglutide, also known as Ozempic, Wegovy, I have heard, I think in hospitals up and down the country, people are getting admitted like anything because of side effects of this drug. And it's being prescribed like candy. It's
and loss of muscle mass and, all these other issues. And even now they're saying, hey, if you're on that drug, you can't just go in and get surgery because you're going to have food sitting in your stomach and you can have aspiration pneumonia. There's a lot of, like, no one talks about these things that aren't as sexy, right? They're saying what a miracle they are.
The doctor, I think the biggest problem with I want to step back, but with the weight loss medications, the biggest problem is doctors. It's doctors prescribing it willy-nilly with no thought, no consideration, no critical thinking to disempowered people. That's in 7 minutes or less, right? So I think if you look at these drugs, right, the issue is the doctors, right? It's the doctors. But to step back, we talked about a number of things that I was taking in, being surprised. Why is it that everybody on the mainstream media, all the countries, they say the same thing? Why is it? And I think the reason why it is because greed and hegemony and the human nature is so predictable. Like Dr. Dan had mentioned historically, right? Greed is predictable. Power, like the need for power is predictable. And these are all things that are predictable, right? So all of these responses, I find actually quite predictable, right? And we should expect them, and we should continue to expect them, because that's the consistent pattern that I've seen, right? That greed and power basically are the theme here. And I think, I want to come back because I think the thing that makes greed and power, the balance of greed and power so disproportionately going to nefarious people, I think it's when we are disempowered as a group of doctors and when we are disempowered as a population. You mentioned, Dr. Dan, what country would want their citizens, to be subdued, right? Every country wants that. Every country wants obedient, non-critically thinking, right? Citizens, right? I mean, there's no other way you can maintain a power structure, right? So when we're thinking about what is the problem, it truly is greed, in my opinion, and it truly is power. And the only way out that I see in the patients that I deal with, 1,000 patients across the United States, is empowerment. Help them understand the lies they've been told, help them understand the nutrition lies, the metabolic lies, the medical lies.
Yeah.
And if you do that, you are now empowering your population. I have direct influence of 1,000 people, maybe online another 200,000, right? You have the direct, Brian also the same, you also the same, right? You have 1,000 patients maybe you can affect a year. And we each have maybe 300,000 people, 500,000 people. Well, Dr. D, with your YouTube, maybe more than that, but we have these people who we can empower with information. And I don't know of any other solution to these problems that you guys are bringing up. And I'm curious for both of you, how are we going to solve this? How are we going to solve this problem? Because I think it's the biggest problem I see my kids facing. I don't know, Dr. D, if you have children, but I got 3 young kids. Maybe Brian will have grandkids soon, God willing. But
Young man still.
yeah. But what are we going to do to solve this?
Yeah, I think it's a great question. I do think it's going to be a bottom-up movement. I also don't think, maybe this is a message of hope as well, is that we shouldn't underestimate how pendulums swing back and forth throughout human history too. So whereas 30 years ago, if you were the obese person, you were the odd one out, and you would go to your doctor who would say, what's going on? You have to reverse this. Now that's considered unacceptable. Who knows where things are going to be in 30 years? I mean, look at what's happening now. I mean, who could have predicted the insanity we're seeing on social media and what's kind of accepted now would have been the case 30 years ago? I mean, you never know which direction the herd is going to move. As Boris Johnson said, the prime minister, as he was about to quit, he said, when the herd moves, the herd moves. And that's a reality of human nature. But you touched on something else, Dr. Tro, super important there about doctors not doing their duty and giving out prescriptions. I actually would take it a step further than this. I've made this point previously. I actually blame a lot of the problems that we see in society on doctors, because people do listen to doctors. And if doctors were doing their jobs, I don't think you would have big food and big pharma running riots at all if doctors had put their foot down and said, this is not the way things should be. Other issues that you see in society, I don't want to veer off into other controversial topics. We could go to many things, including transition procedures on youngsters. Many of those things simply wouldn't happen if doctors had put their feet down and said, this is not how it works. We're going to focus on true health and well-being. So while you have a medical profession that's completely captured, I'm not hopeful that doctors are necessarily going to lead this charge right now. I think this movement is going to come from the bottom up. More and more people are going to wake up, because at the end of the day, gentlemen, I mean, do you know anyone that wants to be unhealthy or wants their kids especially to be unhealthy? Nobody wants that. Nobody. So as soon as more people collectively wake up to what's going on, we will see a movement. I mean, remember, it took 20 years for people to wake up to smoking and the damage that did. I mean, up until the early 80s, doctors were smoking on ward rounds. We were giving cigarettes to patients in hospital. This was not that long ago. This was in our lifetime. And look how quickly we've moved away from that. hopefully we could do the same things for other things like sugar. I hope one day it will be as unacceptable for a nurse's station to have donuts as it is for them to sit there smoking. And don't you hope
Yeah,
it may happen?
Amen.
those are huge things. And I would say, look, I agree 100%. I don't think there's a top down. There's going to be a bottom up because patients are speaking, right? Half of the patients I have in San Diego are a part. They're members of a huge HMO, right? I don't take the HMO. I don't take insurance. They're seeing me on the side. Besides that, why? Because they're like, they're not helping me. They don't know who the hell I am. I walk in there, they got 8 minutes. They're looking at their watch. They're like, and I blame the doctors, but it's the system they're under because they're not going to talk to you about lifestyle, stress, sleep, alcohol, whatever. They got 9 minutes and they have to refill your drugs. They got to do all this stuff, and they're going to have 50 patients that day. So those of us who stepped out of the system and say direct primary care, thank you, Turo. Turo was one of my main instigators to get me out of the system, probably saved my life, right? Now you can think, now I got an hour to sit with patients, right? I just had a new couple come in and we spent an hour and a half just talking about stuff and getting them on track metabolically, right? Because I know the return on investment. The problem with the system is there's an inherent problem. I mean, you look at, like you said, greed. I don't know how much of it's greed. I don't know how much of it's like, I just want to be a good soldier and do what you tell me to do and not question it. But in the hospital, they would PCR test people every single day in the hospital, asymptomatic people that were there with a broken leg. And then sooner or later, they get a positive test. They go, COVID admission. Why? Because we get paid more, right? So there's certain diagnoses we get paid more for, right? And MIPS and MEPS and all this stuff, they go, how many drugs do you have? If they don't have this whole drug thing, you get docked on your pay. The reality was doctors were getting, even if it's subconsciously, not that they're being nasty people, but if you don't have 90% of your people or 80% of your people or 90%, depending on the insurance, vaccinated, you don't get that $200 or $250 per patient. You get zero, you get nothing. So what do? You fire all the patients who won't comply.
But that's
Then,
greed, Ryan. That's greed.
yeah, that's greed.
That's
It's
money
greed, but
over
yeah,
values.
I agree. And I think the big thing, and I would say this to doctors, look, you went into this, I went into this, I know you two went into this to help people. So my responsibility is not to make the medical boards happy. It's not to make Oprah happy or The View happy or Fox News happy. It's that my responsibility is to you as my patient to sit down. And in California, the reason I left is because AB 2098. That was my instigation to go, because they go, if you say anything bad about the vax, we're going to take your medical license. I go, my responsibility. I have friends who are damaged, who have cardiomyopathy. I have friends who died. And I go, how do I not tell my patient that's a possibility? Maybe it's a remote possibility in your case. Let's look at the risk and the benefit of doing that, right? Here's the good side. Here's the bad side. If you get COVID, what's your chance of survival? 99.9x, right? Like, we know that now. So it was one of those things. We had to sit down with our patient and go, look, here's the risk, here's the benefit. And what I can, with 100% certainty, tell my patients is the more metabolically healthy you are, the better are your odds. It's not going to hurt you to quit smoking and drinking and staying out all night and being stress intense and all these other things that we're all talking about. It's like, how come we're not talking about that? And that one thing that I learned is the impact of this podcast. Like, how many people can we reach today? Maybe 20 at max in our exam rooms, and maybe 17 out of the 20 don't give a crap what we're saying. They're going to say, give me my cookies and give me that new drug that I just saw last night on the news. So it's a hard battle. So we have to have patience. And I think the three of us have selected patients who care about their health, right? I'm willing to spend a little bit now to prevent the damage that's coming. How do we work together? How do we delay your celebration of life as long as possible, right? And give you the quality of life that you're going to have. By throwing drugs at you, we never can do that. We never can just throw drugs and make people live longer and healthier and happier lives. There's more, and the patient has to be invested. We have to be invested. The system has to be invested. And so it's a big, and you know, one more thing that helped me get out of that system was the sicker my patient got, the more I got paid, right? If they get an amputation, I get paid more. If they get a dialysis, I get paid more. You get out of control diabetes, we get paid more, because the government thinks, oh, those are sicker patients, so they take more time. What takes more time is preventive medicine. Just saying, let's change your oil, let's check it, rather than blowing up the engine and having to change the engine, doesn't make sense. We're great at changing the engine, but that's in nobody's best interest except people who are going to make a lot of money by changing engines, right? So I think we have to have this new approach to medicine, where I think patients are going to vote with their dollars, and they're going to say, look, I want to go to a doctor who knows me, who's like going to sit and talk to me about my marital problems, and not just say, here's an antacid because your stomach's upset and your blood pressure is high. But why is it high? Those of us with critical thinking, we go, okay, your blood pressure's high. There's like, oh, this is a consolation. Guess what? Are you stressed? bingo, bing, we got it, right? But if you have 8 minutes, you don't have time to discuss those things. So I think it's like we have to hold the doctors accountable for being part of that system. But at some point, the doctors have to stand up and go, look, I want to help my patients. It's for me, I spent years trying to be more efficient. How can I see more patients faster? Right? Because if I didn't, they would take way longer to get in to see me. Now it's standard. Like I was just talking to a patient who's a new patient of mine. She has a new primary, and she said, I can't see them for 2 months. You can't get them for 2 months to see a new doctor. Like, there's a problem, guys.
Yeah.
Right? We have too many sick people and not enough doctors. Guess what? It's not going to go well. And the other thing I'll just throw in, I'll shut up, but the number one profession for suicide is our profession, right? 200 to 400 doctors are killing themselves a year. It's unbelievable. They've dedicated their life to helping people. They go through all this and they realize they're just pill pushers now. I'm not accomplishing anything. I'm just seeing it. Like we all know the course of what's going to happen with diabetes, right? If you don't control the sugars, we know the amputations, the non-healing wounds, all this nasty stuff we don't want to deal with. And we don't want our patients to suffer with that. Neuropathy, all these kind of things. And how do we step back? We have to be healthy ourselves. We can't be working 18-hour days and stress and sleeping 3 hours and priding ourselves on that. We have to take care of ourselves. And then we can be able to help our patients through that. So I think it's a like you guys have all nailed the points, but I think the one thing I will say is like I have hope now that the tide is turning. People are understanding metabolic health. When I call my companies metabolic health, people are like, what the hell? No one's going to know what the hell that is. Now we got Tucker Carlson. We have all these big names, Joe Rogan. We have all these big names talking about it because we know the future forward. We know we have to. Medicare is going bust, guys. You cannot, especially when you're going to give it everyone in the world who steps into the country with no questions asked. You go, it's unsustainable.
Exactly. And I mean, you've obviously done a great thing. And I really do hope that more doctors out there realize that there are ways to think outside the box and work in different ways like we do. I mean, we haven't followed the traditional path. We've kind of been able to divorce ourselves from the system. And lots of doctors out there, even ones that I speak to whenever I'm in the hospital, don't even know that those avenues exist. They think they have to be in a box. And I can see how doctors feel more trapped that way
Totally.
as well. They just don't know what to do. They don't think they have any other skills. They can't step outside, do something unknown. It's very unfortunate. Those statistics are terrible on doctors committing suicide.
Oh my God, you guys, I think we found the solution. Inspire doctors to think critically and help one patient at a time. That is the solution here, right? That is the only solution. And you guys inspire me. Brian, you inspire me. Dr. Dan, you inspire me.
Well, I think what we
and
should
this
do,
is-
Tro, like we all inspire. What we should do is make it mandatory. I don't like anything mandatory. Take that back. But we should highly
Yeah. I'm
suggest,
logging on.
you know what, doctor?
Yeah.
Put your mission, like when you applied to med school, you had to put that mission statement in there of why you're going into medicine. You should put that on your wall in your office and look at that every day and go, that's why I went to medicine. Not to make more money, not to like we knew we'd have such security to some degree. And the other thing is the reason most fear is the killer, right? So most doctors are trapped in a system. They hate it. They're miserable, but they see no way out except suicide sometimes, right? Or like, totally quitting medicine. I know a lot of people who quit medicine now, they're carpenters and they're doing something totally different that they are loving without the responsibility, the stress, and the threat of lawsuits and all those things. But I think when we forget why we're doing it, like we really do, and you go, am I beholden to this corporation?
what?
Am I beholden to my patient, right?
Can we end on this note? Can we end on this note? I'd like to hear from all three of us why we went into medicine, and what that mission statement was. So, Brian, you brought it up. So maybe you start us. What was your mission statement?
Yeah, for me, I was saying, look, I wasn't even thinking about I didn't raise to be a doctor. No one in my family, in the history of my family, was a doctor. And I was like, I don't like doctors. I don't like the attitude. I don't like the God complex. And so I had the opportunity of going to do volunteer work in Mexico with some guys from Flying Samaritans, and they were all med students from USC. And they were amazing people. So it inspired me. They were helping people and compassionate, kind, and bringing meds to people who couldn't, or bringing education, or bringing toothbrushes down. I'm like, man, we can really impact humanity. So for me, when I saw that, I want to help people. I knew I wanted to help people. I was going to do physical therapy or something like that because I like sports. And then I said, these guys are cool. They're cool guys. I would like to hang out with these guys, right? So maybe I'll look into it. So I started doing that. So my thing was like, hey, patients first. I want to help people to live better long. And my mom's entire side, like right now, my cousin's on death's door, like today or tomorrow, and it's the ravages of diabetes, poorly controlled diabetes for years. So when you see that, I go, if I can help people, like I want to do that, And then you get into medicine, you realize I'm not helping anyone by just throwing insulin on everyone and not changing the root cause. And so, yeah, so that was my thing. That really want to help people.
Dr. D, how about
Okay.
you?
Well, I'm of Indian descent, so it's mandatory to consider a career in medicine, first and foremost. So my parents are first generation immigrants from India to England, and I'd grown up thinking medicine was a really good profession. Actually, nobody in my family had ever become a doctor, so I'd considered it, but actually it was a personal tragedy when I was 16, 17 years old. My uncle, who I was very, very close to, was diagnosed with prostate cancer. And when they found it, it had already metastasized to his spine. And I remember being a teenager and reading the reports that I was encountering these words for the first time. And uh, he passed away within 3 or 4 weeks. It was so unbelievably quick. And it was like a horrible end. And that really sort of put it in my mind that I want a career which is about helping people who are sick, because nothing comes before your health and well-being. You can't do anything. You cannot do anything without your health and well-being. I had that realization. I thought, I want to do everything in my power to help people get better from being sick. So that's when I decided to become a doctor.
That's inspirational. My moment was when I was 13 years old and I stepped into Dr. Adis's office, and he made me sit in the waiting room for an hour and a half. And it was my 13th birthday. And he put me on the scale. And at the age 13, I was the current weight I am right now. Okay, as a 13-year-old, 10 inches shorter, I was 207 pounds. And he looked at me and he said, "You're not going to be any different than your brother." My older brother was 350 pounds at age 13 or 14. And you're not going to be any different than your mother. And my mom had struggled with weight. And he said, "You're fat." And I remember walking out of there saying, "I'm going to show this guy." He made me wait for an hour and a half. Why couldn't he put a bike in the waiting room, so I could have ridden it, instead of watching TV. And then I remember thinking, I am going to beat the gene. Beat the gene. I remember walking out of that doctor's office saying, I'm going to beat the gene. And since then, I just between you guys, I've checked my genes and I have all the obesity genes, all of them. FTO, MC4R, and I'm reaching my goal and I'm helping other people do it. That's why I went into medicine, to beat the gene.
That's amazing.
And fuck Dr. Adis. So, I mean, no, he was a nice guy, but
So none of
he
us
was
put upcoding diagnosis, making more money, right? Maybe that was in the back of our mind, but that's the problem. That's where we're at. That's where we're at. And I think that's what, if doctors remember why you went into medicine, I had to question it. Like, why did I go in here? What am I doing here? Am I being effective? Can I be more effective? I have an hour per patient. Heck yes, we can. Like, we can do some damage, right? So we can do some damage on the good stuff, get you off meds, help you, because we have time. Time is for all of us. That's the most critical thing. Time with your family, time working out, time listening to the birds and not accomplishing anything. If I had any downtime when I was in the standard care, I'd be stressed out going, oh, I should be working. We should be working on our notes. We should be getting ready for next week, catching up on last week's stuff, reading something. But, it's that, and I feel for docs that the burnout is real. It's a huge, huge, huge issue. So, and the fear is real. So I think we have to really, I think the only way for now, I think if we can get some good people in, like Suneel saying, then we could revamp medicine. But right now, I think if the ship's sinking, you got to jump ship.
Yep.
Build your ship, build your boat that's going to float, and you help as many dang people to safety as you can, right? We're in lifeboats right now, but maybe we go back to the big ship at some point if they fix it. But I'm not going back. I don't think I'll ever go back. I'm older than you guys, but I don't think I'll ever go back. I mean, this model of medicine is so great that we can invest time up front, make our patients healthier, and we don't have to see them 5 times a week. They can go and enjoy their life and be with their grandkids and do what they want to do, right? We can make people healthy just by talking about stuff that no one else talks about. It's insane, isn't it?
That's
Not only
fantastic.
that,
Yeah.
not only that, Brian, we're publishing our outcomes of this way of, where we submitted it to BMJ. I can't, well, I don't know if I should even say, well, hopefully it goes through the review process. But the outcomes are insane.
Amazing.
Dr. D, I know when you see the outcomes that we're looking to publish, you're going to be so proud.
Oh,
You're
I
gonna
love it.
you're
I'll
gonna
share
look
it
at
on my
them.
social media too. That's great. Well
Yeah,
done.
you're gonna look at it and you're gonna say, this is what medicine should be.
Yeah.
And I can't wait for that. So I think we need to break more people out of the system.
We do, we
Which
do. And I'd like to finish with a quote from Winston Churchill, because doctors, especially who are afraid of breaking outside the system, remember, people will come after you when you're doing something different. But Winston Churchill once said, so you have enemies. Good. That means you've stood up for something and you've had principle at some stage in your life. So remember that.
Yeah, and I think that's so huge. And I have a lot of docs I've lost respect for over the last couple of years, and some who stood out. Like, um, there's certain people that like they went at it. Asim Malhotra, for instance, like a cardiologist. I sat down and he had tea, I had coffee, and we were talking. And this is early on, and he said, if what I'm seeing is true, I'm going to research and I'm going to make sure I'm coming out strong. And he was super pro on one side. Now he totally changed tack based on information and what he saw and his clinical experience, and losing his parents too. That didn't help. That didn't hurt the situation, right? But I think people like that who stood up, and man, you do that and you're like a target, like you said, you're over the target, and they're gonna try to shut you up any way you can. So I think once there's more and more doctors, that's how anything uh uh that's why we started this podcast, Tro, because we go, look, we're not the only ones practicing metabolic health medicine. We called it low carb back then, but we're like, now we see it's the big metabolic health. But now, how many doctors around the world are having unbelievable publishing? I mean, this is what protects us. Go, look, the standard of care sucks. We have to change the standard of care. The standard of care isn't good right now. We got to fix it. So we got to be able to talk and run ideas and clinical experience by each other. And then we have to be open-minded to listen and go, hey, that's working. If plant-based works, all of my patients will be plant-based. If carnivore works, all my patients I can get on plant, right? We have to see and it may be individual for everyone. So I think it's just that we're in that space where we go, what works for you? It doesn't matter what Tro's doing, what Suneel's doing. Like, what's working for you as a patient? Like, how do we work together? How do we make you healthier? How do we do this? And I think that's why we went to medicine. It all comes back to that. And that's why all of us are smiling this morning, early in the morning, and enjoying what we do and are passionate about it. Because how many people are going, oh my gosh, how many prostates did you check this week? It was amazing, right? No one's talking about that. We're talking about, man, we stopped 5 medicines today, and that person's gonna like live longer and they're gonna do better. I mean, that's the joy we get. And a lot of doctors will never have that joy of hearing someone who was totally depressed and suicidal now saying, hey, I'm enjoying life and I'm going out and doing fun stuff and hiking again. It's amazing to give people hope and to see them flourish in life and not just exist.
Well said.
amen.
And
All
the
I can
best
say
part
is
is taking
amen.
Tro out of his vacation for a while, man.
Oh no, this was a pleasure. I didn't want to. I wouldn't have missed it. I wouldn't have missed it. Dr. D, it's just amazing to see you so eloquently, articulate these points in a way that people understand, people relate to, people like. I think the British accent automatically gives you 15 more IQ points than me and
Hey,
Brian.
it's
But
fake. I'm actually from Mississippi. You know that.
but it's
Yeah, he's practiced this for years. That's pretty dang good.
yeah, but it's refreshing and inspiring. And when I end up watching your videos, all I end up doing is just nod. When I see you on social media, I just end up nodding. When I said this off air, I was like, I view you like a brother. Like, I had a certain kinship just seeing the material you're putting out. And thank you for what you do. And I know it wasn't easy to be able to do it, and I know it's still not easy. And if there's any way, we can help you, please, please put us to use.
No, we can help you,
So
man. How do people track you down on social media, YouTube, or if they want to be your patients, how they track you down?
Yeah, absolutely. So you can go to any of my social media channels, type in my name, Dr. Suneel Dhand, on YouTube, Twitter, Instagram. You go to my website, suneeldhand.com, learn about my health programs. Currently very much involved in a program to help men, especially busy men, between 40 and 60, reverse their big guts and their metabolic dysfunction and inflammation. Having a lot of fun doing that, helping a lot of people. But feel free to check me out online. Anywhere I can help you, I'll be happy to.
Awesome stuff, man. Thanks. I mean, I just wish we could all practice together, man. We would have so much fun and like share
Great.
stories and like, but we do in a way anyway.
Yeah,
So even though
we're
we're all
all
kind of separate,
connected
but
online.
man, and I'll tell you, like, there's very few people I would trust my family and my life to, and you're one of them, man. I mean, I know your character and what you're doing, and so anyone out there, if you're in his hood, in his neighborhood and state, get out there and go see this guy. I think that's, we need to really support doctors who are going to step out of the system and do their thing, and so I think it's just amazing. Anyone we can help, any doctor you want to get out, we can come talk and try to figure out a way to get you out, because Tro sprung me from prison, and like I'm really enjoying it. I'm actually going for a bike ride now that you guys made me get up early, so good
me
stuff.
too.
Well, it's been an honor, gentlemen. Thank you for having me on.
Thank you. Thanks so much for joining us.
If you enjoy the show, please consider supporting us on Patreon by going to lowcarbmd.com.